Hi, I'm Garvin. This video is on Trulicity. So first of all, what is it? So when your oral medicine is no longer giving you the control you need, Trulicity may help you get your blood sugar numbers where you and your doctor would like them to be. Once weekly Trulicity is not insulin. It helps your body do what it is supposed to do naturally, and that is release its own insulin, responding when your blood sugar rises. It's used along with diet and exercise to help lower your blood sugar and A1BC numbers. Trulicity contains dulaglutide, a human GLP-1 receptor agonist. So for indications, Trulicity is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. So for dosage, the recommended initiating dose of Trulicity is 0.75 milligram once weekly. The dose may be increased to 1.5 milligram once weekly for additional glycemic control. The maximum recommended dose is 1.5 milligram once weekly. Administer Trulicity once weekly, any time of the day, with or without food. Trulicity should be injected subcutaneously into the abdomen, thigh or upper arm. If a dose is missed, patients should administer as soon as possible if there are at least 3 days until the next scheduled dose. If it is less than 3 days, remain before the next scheduled dose, skip the missed dose and administer the next dose on the regularly scheduled day. In each case, patients can then resume their regular once weekly dosing schedule. The day of weekly administration can be changed if necessary, as long as the last dose is administered 3 or more days before. So some important information about administering Trulicity. Prior to initiation of Trulicity, patients should be trained by their healthcare professional on proper injection technique. Training reduces the risk of administration errors such as improper injection site, needle sticks, and incomplete dosing. When using Trulicity with insulin, patients should administer as separate injections and to never mix the products. It is acceptable to inject Trulicity and insulin in the same body region, but the injections should not be adjacent to each other. When injecting in the same body region, advise patients to use a different injection site each week. Trulicity must not be administered intravenously or intramuscularly. Trulicity solution should be visually inspected for particulate matter and discoloration prior to administration. So how is it supplied? Dosage forms and strengths of Trulicity. It's an injection, 0.5 milligram in 0.5 ml solution in a single dose pen, or as an injection 1.5 milligram in 0.5 ml solution in a single dose pen, and also an injection 0.75 milligram in 0.5 ml solution in a single dose pre-filled syringe, and as an injection 1.5 milligram 0.5 ml solution in a single dose pre-filled syringe. So each Trulicity single dose pen or pre-filled syringe is packaged in a cardboard outer carton, so for storage and handling. You store Trulicity in the refrigerator at 2 to 8 degrees. Do not use Trulicity beyond the expiration date. If needed, each single dose pen or pre-filled syringe can be kept at room temperature not to exceed 30 degrees Celsius for a total of 14 days. Do not freeze Trulicity, and do not use Trulicity if it has already been frozen. Trulicity must be protected from light. Storage of Trulicity in the original carton is recommended until time of administration. Discard the Trulicity single dose pen or pre-filled syringe after use in a puncture-resistant container. The side effects. So the following serious reactions are described below or elsewhere in the prescribing information. Risk of thyroid C cell tumours, pancreatitis, hypoglycemia with concomitant use of insulin, hypersensitivity reactions, renal impairment, severe gastrointestinal disease. Contraindications would be Trulicity is contraindicated in patients with a personal or family history of medullary thyroid carcinoma, or in patients with multiple endocrine neoplasia syndrome type 2. Trulicity is contraindicated in patients with a prior serious hypersensitivity reaction to Dulicity or to any of the products components of it. Serious hypersensitivity reactions, including anaphylactic reactions and angioedema, have been reported with Trulicity. So the mechanism of action. Trulicity contains dulaglutide, which is a human GLP-1 receptor agonist with 90% amino acid sequence homology to endogenous human GLP-1. Dulaglutide activates the GLP-1 receptor, a membrane-bound cell surface receptor coupled to adenyl cyclase in pancreatic beta cells. Trulicity increases intracellular cyclic AMP in beta cells, leading to glucose-dependent insulin release. Dulaglutide also decreases glycagon secretion and slows gastric emptying. So for more information, you can contact me through the Life Pharmacist on the website, email me or call into Lynch's Pharmacy in Broaddale, up Mary Burrell in Douglas and Cork. Thank you for watching.